we work with manufacturers to understand what they need, how we can help them kind of understand what the value is that their product has, what's that value proposition, and then how do we communicate that to their customers so that the value is understood and that they can get proper placement and access to the patients that they need. The whole idea is that, the patients have access to that drug and it's utilized, right, in an appropriate way that brings relief or curative value to the patients that need it. And that journey that we have with that customer, and that journey that we facilitate between our customer and their stakeholders, the health plans, the patients, the physicians, and sometimes sites of administration, sites of care as well. I think the one that becomes most clearer in my mind is projects we did for a manufacturer who was bringing a novel treatment for postpartum depression. And in their journey, they really had to understand kind of what the journey of that disease was for patients, in addition to how they would seek treatment and how we could support that treatment-seeking behavior. And the reason why it stands out to me is because, that is a disease, an illness that has a lot of emotion and social impact to it. A lot of stigma historically has been associated with that. So just getting patients to try and seek diagnosis, let alone behavior, is a huge journey that patients have to undergo. So the manufacturer needs to support that journey, and really build support systems in and partner with advocacy groups and other kinds of agencies to help build support and kind of fully develop a journey for seeking that kind of diagnosis and then treatment in ways that would be easy for a patient to traverse, and not as socially detrimental, for lack of a better word. And so I think that just highlights the needs in my eyes of a pharmaceutical manufacturer, but any organization that, for them to kind of meet their goals and fulfill their journey, it's important and critical to think about, that patient journey and start beyond taking their drug, right? But what is the whole pathway of getting there and helping through any kinds of barriers? And so I think that was one of the ideal examples, because it just highlights that need for having that understanding and being able to kind of combat barriers and put yourself in their shoes, because it's not just as easy as going to the physician and asking for a prescription, or going to a physician and say, I don't feel like myself, because there are things that we might not think about on the social and emotional level, in this case, that also has to be part of that consideration of their patient journey.
That's one of the best examples I've ever heard, Earlene, and I'm really glad that you mentioned that, because, talk about not just making a difference, but talk about having a clearly defined business goal or a business impact objective, for a project like this, right? And I don't think anyone will have any doubts that when a pharmaceutical company, in this case, when they embark on a journey project with a goal like what you've just outlined, I mean, the ROI, the financial impact almost becomes secondary. Now we're getting towards the greater good of, we really need to do this, for this, if we are successful, now we're no longer worried about adoption and ROI and all those things. Now it's truly helping the patient, in helping them get relief from this ailment.